Hello, everybody. Barack Obama, July 22nd, 2009, stated, "I want to cover everybody." Now, the truth is, unless you have what's called a single-payer system, in which everyone's automatically covered, you're probably not going to reach every single individual. So, universal health care will cause problems within our nation. My secondary claims are universal health care is unrealistic in our economy. It will raise our taxes dramatically, and it will be available to illegal immigrants causing sufficient harm. The reason it's unrealistic to our economy is that there's not enough doctors to take care of patients. There's only 1.5 million physicians in the United States of America, and we have over 311 million citizens. So look at the statistics right there. There's no way we'd be able to cover everyone. Okay, Dr. John R. Batista and Justine McGade from the case of universal health care and healthcare in the U.S. The U.S. spends at least 40% per capita on healthcare than any industrialized country with universal health care, including Canada. Okay. Another reason is federal studies by the Congressional Budget Office and General Accounting Office show that a single-payer universal health care would save $100 to $200 billion per year, despite covering all the uninsured and increasing patients. They don't take into consideration that it would cost over $1 trillion to cover all the uninsured and increasing patients. The cost of healthcare in Canada as a percent of GNP, which were identical to the U.S. when Canada changed to a single-payer universal healthcare system in 1971, have increased at a rate much lower than the U.S., despite the U.S. economy being much stronger than Canada's. Not taking into consideration how many more citizens the U.S. has compared to Canada, we have about 9 times as many citizens as Canada does. Okay, and then another reason is the healthcare system in Canada is funded by a public of 70% and private, which is 30%. So that's saying we'll take 70% of your taxes and you can have universal health care. So I don't know if that sounds fair to you guys, but it doesn't really sound fair to me. Dr. John O'Shea from the Doctors' Debate says that the fundamental flaw in universal health care systems is the misplacement of incentives. So what's the reason your parents got a job? So that they have health care for you and your entire family. Those incentives would disappear. Why would you work for these big companies if everyone's getting the same thing? I think it's more of like a socialist idea. But I believe having insurance is very important, but nothing is free in this world. If the bill is approved, we will pay for it in our taxes. Now, the raise of taxes, Dr. John S. O'Shea from the Doctors' Debate says again, compared to the private sector, government programs are inefficient and higher in cost and have to be paid by higher taxes or spending cuts in other areas such as defense, education, or even medical research and development. This is a trade-off that most Americans would not be willing to take. The current national debt is established at $14,666,536,610.96. So I just don't think we have enough money to fund another $1 trillion out there and make it 16 or 15 trillion. And now Evan McArthur with the Guardians, right? One of the main doctor groups warned today that Obama's plan would lead to an explosion in health insurance costs. The cost of expanding health insurance to 45 million is estimated at $1 trillion, and that's the amount of people that are uninsured in the United States. The raise of taxes. The reason universal health care works in Canada is because they only have 34 million citizens compared to the U.S. with over 311 million. I mean, I have the exact numbers, but they're just too long to read out. And the last thing our government needs is to bail out all the citizens who are not responsible enough to insure themselves. Now, on the issue of illegal immigrants, there's an estimated 13 million illegal aliens living on the U.S. territory. Can we really afford to insure the entire country? Obama says on The Guardian, and if you can't afford one of the plans, we should provide assistance to make sure you can. So if you were born in the U.S., that officially makes you a U.S. citizen. That gives immigrants more of a reason to try to sneak over our borders and be born here. To get his reforms through Congress, Obama will certainly have to compromise. He has already hinted that he might back down on some of his points, such as accepting that there are some individuals who, even with government help, will still be unable to afford to pay with health insurance. My conclusion is that universal health care will cause more problems to the nation. It is unrealistic, will raise taxes, will be available to illegal immigrants, and these are all the reasons I disagree with universal health care. Thank you.
All right, the background information is okay. Your main point is pretty clearly stated, although I do think it's a little broad. The secondary points were nicely laid out in the preview, and you signposted the first one clearly. The second point I didn't think internally was signposted as clearly. The third point you did signpost very clearly. You've got a lot of information in the speech, but sometimes it's kind of confusing. On the first point, it sounds at first like you're talking about how the Canadian system works and how it could work effectively and how, in contrast, it's reduced costs and all those kinds of things. Then it turns around and it really seems like you're saying that this isn't the way to go, that there are particular problems with this, but I didn't hear any particular problems with the Canadian system, just an argument that says it's not really applicable to the U.S. because of the size, but I didn't get any explanation about why that was the case. There was some good evidence about cost issues that you had in the body of the speech. The information about the doctor-patient ratio, for instance, I think is a good statistic to use if you can show, for instance, that there would be that much demand. The ratio of doctors to patients in other parts of the world and their healthcare systems, if you could do some comparison and show that we don't really have enough or it's going to end up result in rationing, I think that would help advance your claim. You are citing authorities on a pretty regular basis, and I appreciate that, but like I said, I sometimes couldn't quite figure out how the information was supposed to be used, because it did sometimes sound like it was describing something positive about the single-payer system, and then other times you were making inferences about the negative aspects. You got off on the illegal immigration topic, and I'm sure that there are cost issues involved and other questions that are important, but you basically raise the issue and don't really develop it, so I don't know how I'm supposed to use that in my assessment of whether or not universal healthcare systems can work effectively. So you need to have, I know at the end I thought the summary helped refocus your position a little bit, but the way the information was being presented in the body of the speech, I didn't think that it always was consistent in supporting the position that you were taking. Thank you.